Congressional investigators say they have uncovered what appears to be a massive, multi-state fraud network operated by career criminals who allegedly create fake businesses, fake daycare centers, and questionable healthcare operations designed to siphon taxpayer money from government programs. What began as investigations into fraud in Minnesota has now expanded into multiple states, revealing strikingly similar patterns. Witnesses and investigators claim many of the same individuals move between states, establish new companies, bill Medicaid and other government programs, dissolve those businesses, and then repeat the process elsewhere. While arrests and prosecutions continue to mount, critics argue that many political leaders connected to states where these schemes flourished continue to seek higher office or re-election, instead of answering difficult questions about how these operations were allowed to grow unchecked. One of the biggest political flashpoints surrounding these allegations involves Minnesota Representative Ilhan Omar, who recently announced her re-election campaign. Her decision has reignited debate over allegations connecting individuals within her political orbit to Minnesota's massive fraud scandals. Critics insist that voters deserve answers regarding where taxpayer money went, who benefited from these schemes, and whether elected officials ignored warning signs. Supporters argue that allegations should be separated from proven wrongdoing, but investigators continue digging deeper into networks that allegedly generated hundreds of millions of dollars through fraudulent government billing practices, while ordinary Americans struggle with rising costs of living. At the center of many of these investigations is a broader question about how government assistance programs became vulnerable to exploitation. Testimony presented to lawmakers describes daycare centers, home healthcare agencies, autism service providers, and adult daycare facilities that allegedly billed enormous sums despite limited evidence that services were actually being delivered. Some operators reportedly accumulated tax debts, dissolved companies, and reopened under new names elsewhere. Investigators claim the fraud was often hidden behind legitimate programs designed to help vulnerable populations, making detection difficult until the scale became impossible to ignore. Critics argue that systems built on trust became easy targets for people willing to abuse them. The situation becomes even more alarming when investigators describe what they believe is an organized network operating across state lines. Witnesses testified that individuals involved in one state frequently had business partners or relatives involved in similar operations elsewhere. According to testimony, large amounts of cash allegedly moved between states, while new healthcare and daycare businesses appeared in locations where oversight was limited. Investigators described what they believe are interconnected operations, functioning almost like franchises of fraud, expanding into new territories whenever scrutiny increased in previous locations. The allegations paint a picture not of isolated incidents, but of a coordinated effort exploiting weaknesses in government systems nationwide. One particularly controversial area involves adult daycare centers and home healthcare services. Investigators claim these facilities have multiplied rapidly in certain communities, while generating enormous Medicaid reimbursements. According to testimony, some seniors may have been encouraged to participate in programs they did not fully understand, while operators allegedly billed for services that were unnecessary or never provided. Witnesses described cases involving medications, medical equipment, transportation services, and personal care assistance that may have been prescribed primarily to maximize reimbursements rather than address genuine medical needs. While many providers operate legitimately, investigators warn that bad actors may be using these programs as gateways into broader fraud schemes. The fraud allegations extend beyond individual facilities and suggest an ecosystem of interconnected businesses. According to testimony, fraudulent operators allegedly collaborate with pharmacies, medical equipment suppliers, transportation providers, and healthcare agencies to create streams of billable services. In some cases, investigators claim seniors were offered incentives to participate in activities that generated government payments. The concern is that once a person enters one fraudulent system, they become connected to multiple others, allowing operators to extract increasing amounts of taxpayer money through a web of coordinated billing practices. This structure makes investigations complex because every piece of the network may appear legitimate when examined individually. Lawmakers have repeatedly questioned witnesses about the scale of the problem, and the answers have been staggering. Testimony suggests thousands of individuals may be involved nationwide, with potential losses reaching into the billions of dollars. Investigators described large gatherings organized by advocacy groups and healthcare organizations where participants allegedly arrived using Medicaid-funded transportation services. Critics argue that these programs have evolved into political and financial machines capable of generating enormous revenue streams while simultaneously creating constituencies that resist reform. The result, they claim, is a system where fraud becomes increasingly difficult to challenge because too many interests benefit from its continuation. Another area under scrutiny is the Affordable Care Act marketplace and Medicaid enrollment systems. Officials now estimate that millions of enrollments may warrant closer review due to concerns about improper sign-ups, duplicate coverage, or inactive beneficiaries who rarely use the services they are enrolled in. Some investigators argue that brokers and third parties may have enrolled individuals without their full understanding in order to generate commissions or payments. If true, these practices could be costing taxpayers billions, while simultaneously driving up healthcare costs for everyone else. Critics believe these issues illustrate what happens when expanding enrollment becomes a greater priority than verifying eligibility and preventing abuse. As investigations continue, political accountability remains a central theme. Critics argue that elected officials in states where major fraud schemes operated should explain how such widespread abuse escaped detection for so long. Some claim whistleblowers were ignored, sidelined, or discouraged from pursuing suspicious activity. Others point to public officials who continue dismissing concerns as politically motivated, despite mounting evidence and convictions. Supporters of those officials counter that fraud exists in every system, and that prosecutors, not politicians, should determine responsibility. Regardless of where people stand politically, the investigations have intensified demands for transparency and oversight. The broader concern raised by these scandals is what they reveal about the future sustainability of government programs. Every fraudulent claim paid out represents money unavailable for legitimate recipients who genuinely need assistance. Investigators argue that eliminating waste, fraud, and abuse could dramatically improve affordability while preserving programs for those they were designed to help. Whether the problem stems from negligence, flawed incentives, inadequate oversight, or deliberate exploitation, one thing is becoming increasingly clear. Americans are demanding answers. As more investigations unfold and more arrests are made, the public will be watching closely to see whether accountability reaches beyond the scammers themselves and extends to those who may have enabled, ignored, or benefited from the system that allowed these schemes to flourish.